Hello, welcome back to our channel. Today we'll discuss what polyhydramnios, also known as hydramnios, is, its causes, symptoms, complications and treatment options. What is polyhydramnios? Polyhydramnios, also known as hydramnios, is a medical condition that occurs during pregnancy when there is an excessive amount of amniotic fluid surrounding the fetus. The normal amount of amniotic fluid during pregnancy ranges from 500 to 1,000 milliliters, but when the amount of amniotic fluid exceeds 2,000 milliliters, the condition is considered polyhydramnios. This condition affects approximately 1% of all pregnancies and can pose a risk to both the mother and the baby. Polyhydramnios can be caused by various factors, including maternal diabetes, fetal anemia, fetal malformations or abnormalities, multiple pregnancies, placental abnormalities, and genetic disorders. Treatment for polyhydramnios depends on the severity of the condition and the underlying cause and may include procedures such as amnioreduction, medication, and monitoring. Early detection and treatment are important to prevent potential complications such as premature rupture of the membranes, preterm labor, placental abruption, and stillbirth. Please like and subscribe to our channel and click bell icon to get more health updates. Causes of polyhydramnios. Maternal diabetes. Women with diabetes have a higher risk of developing polyhydramnios. Fetal anemia. Anemia in the fetus can cause an increase in blood flow to the placenta, which in turn can lead to an increase in amniotic fluid. Fetal malformations or abnormalities. Certain fetal abnormalities, such as gastrointestinal or neurological defects, can interfere with the absorption and excretion of amniotic fluid, leading to an increase in the amount of fluid. Multiple pregnancies. Women carrying twins, triplets or more have a higher risk of developing polyhydramnios due to increased fluid production by each fetus. Placental abnormalities. Abnormalities in the placenta, such as placental chorioangioma, can cause an increase in amniotic fluid. Genetic disorders. Certain genetic disorders, such as Beckwith-Wiedemann syndrome, can cause polyhydramnios. Symptoms of polyhydramnios. Abdominal discomfort or pain. Women with polyhydramnios may experience discomfort or pain in their abdomen due to the increased pressure from the excess fluid. Shortness of breath. The increased size of the uterus and pressure on the diaphragm can make it difficult for women with polyhydramnios to breathe. Swelling in the hands and feet. Excessive amniotic fluid can put pressure on blood vessels and cause swelling in the hands and feet. Difficulty breathing. Women with severe polyhydramnios may experience difficulty breathing, which can be a sign of respiratory distress. Preterm labor. In some cases, polyhydramnios can lead to preterm labor and delivery. Complications of polyhydramnios. Preterm labor and premature birth. Women with polyhydramnios are at a higher risk of going into preterm labor and delivering the baby prematurely. Placental abruption. Polyhydramnios can increase the risk of placental abruption, which is a serious condition where the placenta detaches from the uterine wall before the baby is born. Postpartum hemorrhage. Women with polyhydramnios are at a higher risk of experiencing postpartum hemorrhage, which is heavy bleeding after delivery. Fetal distress. Excessive amniotic fluid can put pressure on the fetus, leading to fetal distress and potential oxygen deprivation. Cord prolapse. In rare cases, polyhydramnios can increase the risk of cord prolapse, which is when the umbilical cord slips through the cervix and becomes compressed during delivery, cutting off oxygen to the baby. Cesarean delivery. Women with polyhydramnios are more likely to need a cesarean delivery, particularly if the baby is in a breech position or there are other complications during delivery. Treatment for polyhydramnios. Amnioreduction. This is a procedure where a needle is inserted through the abdomen into the uterus to drain off excess amniotic fluid. This procedure can help to relieve the pressure on the mother's abdomen and reduce the risk of complications. Medications. Medications such as indomethacin or prostaglandin synthetase inhibitors may be prescribed to reduce the production of amniotic fluid. Monitoring. Regular monitoring of the mother and baby is essential to ensure that the condition is being managed effectively and to detect any potential complications. Delivery. If the condition is severe or there is a risk of complications, delivery may be recommended, even if it is earlier than the due date. It is important to note that the treatment for polyhydramnios may vary depending on the underlying cause and the specific needs of the mother and baby. Women with polyhydramnios should work closely with their healthcare provider to develop a treatment plan that is appropriate for their individual situation. Thanks for watching. Please do like, subscribe and click bell icon for more health videos. Also lets us know, how would you want us to improvise videos, or which health condition you would like to explore in comment section.